My name is Jamie Belafante. I am a BSN student at Indiana State University. Today, we will be discussing sexually transmitted infections among African Americans. Learning objectives for today is, upon completion of this presentation, learner will be able to discuss the definition of sexually transmitted infection, identify health disparities within the population, discuss various types of sexually transmitted infections, recognize contributing factors, utilize preventative measures, and find information on where to seek help if needed. Please pause for a moment to take a brief pretest that is located in the description box below. You can copy and paste that link within your web browser. What is an STI? An STI is a sexually transmitted infection that is spread from one person to another through oral, vaginal, or anal sex. What are the causes of health disparities? Health disparities are variances in incidence, prevalence, morbidity, or mortality rates among a certain population in regards to health conditions. Some disparities within African American population for contracting STIs are lack of access to care, underinsured or uninsured, lack of knowledge on health related topics, racial and ethnic preferences, and income. In 2008, African Americans were accounted for 42% of the 37,968 new IV diagnoses in the United States and dependent areas. Of this number, the new HIV diagnoses in the U.S. and dependent areas in 2008 were 42% amongst adolescent African Americans, 31% were among African Black men, and 11% were African American Black women. In the United States, the death rate for African Americans were 43% of all the deaths of people diagnosed with HIV. Overall rate of reported chlamydia cases among Blacks in the U.S. was 1,192.5. The rate of the reported chlamydia cases among Black females was 5 times the rate among white females. The rate of the reported chlamydia cases among Black males was 6.8 times the rate among white males. Rates of reported cases of chlamydia were highest for Blacks ages 15 to 19 and 20 to 24 years. The rate of the reported chlamydia cases among Black females aged 20 to 24 years was 3.7 times the rate among white females in the same age group. Among females aged 15 to 24 years, the population targeted for screening, rates were highest among Blacks in all regions. Reported gonorrhea cases among African Americans was 7.7 times the rate among whites. The disparity in gonorrhea rates for Blacks in 2008 was larger in the Midwest and Northeast than in the South and West. Gonorrhea cases were highest for Blacks aged 20 to 24, 15 to 19, and 25 to 29 years in 2008. The rate of reported gonorrhea cases among Black females aged 20 to 24 years was 6.9 times the rate among white females in the cases among Black females aged 15 to 19 years was 8.8 times the rate among white females in the same age group. Among Black males aged 20 to 24 years, the rate of reported gonorrhea was 9.4 times the rate among white males in the same age group. Males aged 25 to 29 years was 7.0 times the rate among white males in the same age group. 34.7% of reported syphilis cases was of African Americans. The reported rate was 4.7 times the rate among whites. This disparity was similar for Black females and males. Contributing factors. There are less frequent usage of condoms, drug and alcohol use during sexual intercourse, early initiation of sexual contact with a new partner, engaging in paid-for sex relationships, having multiple partners, and also having sex at a young age. Various types of STIs. Chlamydia often has no symptoms and damage a woman's reproductive system if no detection is continued. However, some may experience painful urination, vaginal discharge, painful sexual intercourse, and bleeding in between periods and after sex in women, discharge from the penis, and testicular pain in men. Human papillomavirus, which is also HPV, often goes away on its own within 2 years of contraction with no complication. But for HPV that does not go away, individuals see a small group or bump appear in the genital area, which can be large, raised, flat, or cauliflower shaped. Development of cervical cancer can also occur. Therefore, you receiving the Gardasil vaccine for this, which can help in prevention. Gonorrhea, also called CLAP, for some women may have symptoms and can also show up after a week following infection, which include pain or burning, feeling when you urinate, yellow or blood discharge from the vagina, bleeding between periods. Men are more likely to exhibit symptoms such as yellow, white, or green discharge from the penis, pain or burning during urination, pain or swelling in the testicles. Anal gonorrhea often doesn't have any symptoms, but signs and symptoms may include itching in or around anus, discharge from anus, pain with bowel movement, and gonorrhea infections in the throat also rarely cause symptoms. However, if symptoms do show up, it's usually just genital herpes are usually worse during the first outbreak or flare-up called primary herpes. Symptoms typically appear within 2 to 20 days after infection. Active symptoms may last up to 4 weeks. An individual may experience flu-like symptoms, genital itching, burning or irritation, painful blisters or sore that break open, or headaches, pain during urination, and swollen lymph nodes. For recurrent outbreaks may last 3 to 7 days, and a person may experience itching or burning at the site where the virus entered your body, pain in the buttocks, lower back, thighs, or knees, genital blisters or sores. Herpes outbreaks may be triggered from stress, illness, fever, sun exposure, or menstruation. HIV or AIDS infection can show flu-like symptoms within 2 to 4 weeks of contraction and may last a few days to weeks, which includes fever, chills, rash, night sweats, muscle ache, sore throat, fatigue, swollen lymph nodes, and Stage 2 is called clinical latency, which is chronic HIV infection. With adequate treatment, a person may remain in this stage for 10 to 15 years. No symptoms may also be experienced within this stage. Stage 3 is the progression of AIDS with certain criteria met. Symptoms may include rapid weight loss, recurrent fever, or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph node glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, pneumonia, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids. Memory loss, depression, and other neurologic disorders can also. Treatment options. What are your options? There are various preventative treatment options used based upon the type of infection contracted. Antibiotics are often in a single dose, can cure many sexually transmitted bacterial and parasitic infections, including gonorrhea and chlamydia. Typically, you'll be treated for gonorrhea and chlamydia at the same time because the two infections often appear together. Once you start antibiotic treatment, it is necessary to finish the prescription. If you do not think you'll be able to take the medication as prescribed, tell your doctor. A shorter or simpler course of treatment may be available. If necessary, to abstain from sex until 7 days after you've completed antibiotic treatment and any sores have healed. Antiviral drugs, if given to you if you have herpes or HIV. Fewer herpes breakouts can occur if daily suppressive therapy with a prescription antiviral drug is given. The sooner HIV is more effective it is. There are many ways to prevent an STI, which includes abstinence, using latex condoms, staying in a long-term relationship with one sexual partner. Prior to initial sexual encounter, get yourself tested. Communicate with your sexual partner to personal wants prior to sexual contact. Do not drink excessive alcohol and use drugs. Being under the influence increases sexual risk. And get vaccinated to prevent certain STDs such as HPV. Have any further questions, you can contact your PCP, visit the cdc.gov website, healthypeople.gov, your local neighborhood clinic, plannedparenthood.org, and other reputable online websites. This concludes our presentation. However, please take a moment to test what you have learned today with the post-test question that is located in the description box. You can copy and paste this link within your web browser and to test what you have learned.